Healthcare inflation is a big challenge. We are suffering from staffing shortages, and we know that within the field of urology, we have a national shortage of urologists.
We're seeing a lot of people retire. Certainly the pandemic didn't help with this as well. And so there's a discrepancy between the need and what we have available for urologists.
When we speak about treatment outcomes and the patient experience, these are critical factors to their plan of care, and be able to deliver that high quality service that our patients not only need, but they desire and they expect from us.
What we have developed here at Lehigh Valley Health Network is a community-based urology program that we think is really going to become the next generation of healthcare, specifically in urology, but I think really in all areas throughout the country. The idea is to utilize the best concepts of academic medicine and bring them to the community setting. Unfortunately, sometimes it's difficult for patients seeing academic urologists who are specially trained with certain areas of expertise and sub-areas of expertise. We brought that to the community to deliver world-class care for all of northeastern Pennsylvania. We want to do so in a way where we base this care on centers of excellence so that we can optimize care while improving efficiency for all of our patients.
So we have 4 different unique centers of excellence within the urology program. We have oncology and advanced robotics. We have men's health, BPH, and male infertility. We have endourology and stone disease, and the 4th center is female urology and pelvic reconstruction. What this allows us to do is really focus in these subspecialty categories, driving clinical advancements. We can improve clinical efficiencies and improve the overall outcomes for patient care across the board. We've been doing this since over 13 years ago and have built upon it to about 8 locations at this current time. So we went from 1 doctor and 5 initial supporting staff to 150 total staff within the urology service line. This way you have the attending working to the top of their license, the APC working to their top of their license, and really kind of delineate the right care management for the patient on the disease that they're looking for.
In our urology practice, we make sure to use our APCs to the top of their license. So not only is that seeing patients in the office and providing great care there, but my APCs are trained to do procedures, whether that's vasectomies, Botox injections, urodynamics, stent removals. We really put together a rigorous training program because as APCs, we're not trained to be urology providers. We're trained to be general practitioners. We are able to use our APCs as first line for our patients so they can get in the door faster, they can get the care they need faster, they can get triaged to the operating room, to the procedure that they may need. This then opens up the attending schedule so they can operate, they can do these procedures that the APCs perhaps can't do, and we can be there to be the first lines and still give the patients the best care.
We cross-train all of our staff within all of our centers of excellence. This helps out with their personal and professional development, but it also helps out the practice. So we have our nurses that also act as providers. They see their own patients. We have our medical assistants that receive continuing education on all of our procedures. What we are working on right now is a regional live call center that is staffed by our clinical staff that are all cross-trained on all of your urological needs. So this has helped us as far as if one office is busy, then they call into the central call center. We answer it in a timely manner. We're able to address post-op complications, different medication questions, and on everything that involves their treatment and their plan of care, so that way the patients receive the highest quality.
From the second the patient calls for an appointment, that person on the other side of the line has to say, we're gonna get you in and we're gonna get you in with one of our PAs, and he or she is the best. They are the doctor's right-hand man or woman, and they know exactly what that doctor's gonna know, and they're gonna make sure that you get the best care.
It is our purpose to stay on the cutting edge of technology so we can deliver it to this community in an economical way that is still safe and state-of-the-art.
We have many partnerships with industry, from Medtronic to Procept to Boston Scientific, and we're bringing the latest and newest and greatest technology here. The Centers for Men's Health at Lehigh Valley Health Network specializes in the medical and surgical care for men's health conditions. We are able to offer a wide range of different options of care, such as UroLift, Resume. We also offer the conventional and traditional procedures such as TURP and HOLEP, but we know that they are fraught with sexual side effects. So I'm very proud to announce that we're also offering robotic water jet therapy, also known as aquablation, which can maximally disobstruct the prostate while minimizing the sexual dysfunction that men can face.
The urology service line at Lehigh Valley Health Network continues to be innovative, whether it's a single port robot, whether if it's focal one therapy. We're continuing to be a regional leader in offering services that is not offered throughout Northeast Pennsylvania, but they're offered within our institution.
We are on the cutting edge of all technologies in the urological field. So we are trend setting within the field, and I can see that both on a local level, a regional level, and as well as a national level.
Our ultimate goal is to provide the best care to the patients, not only in this region and our region here in the Lehigh Valley, but in the state of Pennsylvania and beyond.
We're excited where we are now and where we've grown in the past 13 years, but we're even more excited about where we're going to go. Our future is bright, and we can't wait for it.